Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
From seizures to diabetes to anxiety and beyond, there's a dog for that. Service dogs help people with a variety of medical conditions so their owners can live independently and enjoy life to the fullest. These dogs are loyal and loving care partners, always ready to assist. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we talk about four-legged healthcare workers, and we'll even get to meet one. We'll be right back. Welcome back. I would like to introduce my first guest on today's show, Allie Cowan from Wind River Tales and Trails. Allie, welcome for our show.
Thank you.
Thanks so much for being here.
Thank you.
Can you just start out by talking a little bit first about your education, your background, and your experience with training these animals?
Absolutely. So I have a bachelor's degree in psychology with a research emphasis. So my focus during my studies was research in animal behavior, and so we were the people that were kind of sitting in the lab doing tests on rats rather than the ones that were taking emotional well-being charts in the clinical program. I actually started out as a wildlife biology student, wanting to work with wolves and other wild animals, and I actually adopted a husky from the Humane Society of Western Montana in Missoula. And he was an adult dog, he had lots of issues, and so we took a dog obedience class. And we did really well. We had a lot of fun, and I thought this would be a really cool job.
Yeah.
So I ended up switching my major from wildlife biology to psychology, getting my degree there, and then I also took a certification course through Animal Behavior College, which is a dog training certification course. And so I graduated from that program. They have a hands-on apprenticeship at the end. And then I started training privately while I was in college finishing my degree. I actually worked at PetSmart as a trainer for about a year and a half. And then I got on with Wind River Tales and Trails, which is kind of the supporting arm for the Wind River Bear Institute. And that organization uses dogs specially trained for wildlife conservation. So I started out working with those dogs and working with pet dogs, and service dogs is something I always wanted to do, so I kind of developed our own program.
Okay, and you train different kinds of service dogs, right? So can you tell a little bit about the difference between a service animal and an emotional support animal?
Absolutely. When service dogs first kind of became recognized as medically helpful and necessary, it was pretty easy to tell the difference because service dogs were pretty much for guide dogs for the blind, mobility assistance dogs for people in wheelchairs and other types of physical disabilities. But as they started recognizing the benefit for mental health and mental disabilities, that line became a little bit more gray. So there's two really big differences between an emotional support animal and like a psychiatric service dog. An emotional support animal is really just a pet. They just are trained, or they're just there for companionship and comfort. They don't really do anything.
Okay.
They are exempt from housing restrictions. So like if you live in an area or in an apartment or a house that doesn't allow pets, they don't apply to that rule, but they don't have the same ability to accompany their handler in all places like a service dog does. The main difference is that a service dog is trained to perform a specific task that mitigates the handler's disability. So they have extensive training not only to behave in public, but they also have a very specific thing they do to help their handler. So the big differences between an emotional support animal and a service dog are first that the owner has to have a disability. Some people with emotional support animals have a mental condition, like depression or anxiety or something like that, but it's not debilitating enough to be considered disabling. So that's one of the primary differences, and then the other is the training.
Okay, and so you talked about that the person has to have a disability. So what are some of the different things that these service dogs will do? What are their jobs, I guess?
Absolutely. So there's the one that most people know about, which is guide dog. So they guide a person who's blind. There are mobility assistance dogs. So those are dogs that assist somebody in a wheelchair or somebody that has another physical disability that prevents them from kind of performing everyday activities like opening and closing doors, picking up objects that they've dropped. You also have dogs that help provide kind of momentum and balance assistance for people that have balance issues, or they have an issue with like one side of their body, something like that. And then there are ones that people don't know as much about. So there are dogs that can alert to high and low blood sugar for people with diabetes. There are dogs that can respond in the event of a seizure. There are some dogs that can even predict seizures, although that's not something you can train. And then there are also dogs that help with psychiatric disabilities. So dogs that help people with PTSD. And panic disorder by kind of mitigating some of the triggers that cause those panic attacks. They can create space for their handlers in a non-aggressive way. Service dogs can't be aggressive. So they can create space. They can also alert their owner to an oncoming panic attack or anxiety attack so that they can get somewhere safe before that happens.
Okay, so you talked a little bit about the seizures, and that's what we're going to talk more about today. So there are dogs that can predict seizures. How do they do that?
Nobody really knows for sure. They think that it has something to do with chemical changes in the body that the dog's picking up by scent, but there is currently no definitive way to test for that ability in a dog and no definitive way to train for it. Either a dog has that ability or it does not.
Okay.
Katie, who we're going to talk to today, I'm sure you probably have a follow-up question on that, has never demonstrated that ability, so she is trained as a seizure response dog.
Okay, and you mentioned diabetes as well. How do dogs sense if somebody has low blood sugar?
That one is a lot better understood. That one is definitely scent-based training. So the dog is picking up changes in the ketones in somebody's breath. So they smell the person's breath, they smell their sweat, their saliva, and they can actually detect those changes. And we train them very similar to the way that you would train like a bomb sniffer dog or a drug sniffer dog. So very, very similar.
Wow, okay, and so is it a certain breed that has that ability, or can any dog smell someone's breath like that?
Almost any dog can do that and make that detection. The difference between dogs that can be trained to do this and dogs that can't are how much desire they have to work. Because if they don't have any desire to work for a sort of reward that follows detection of that scent, then they're not going to alert their owners. Because they don't have any reason to, they don't care. So the big difference is that dogs have a drive and a desire to please and to earn a reward, which kind of makes that ability there or not.
Okay, and so just one last question really quickly before we take a break. Can someone watching at home get their dog trained to help them if they have some sort of condition where they need that service?
Absolutely. One of the biggest differences between our program and a lot of the bigger organizations out there is that we want to make service dogs accessible to those who need them. We recognize that people that have, a severe or serious disability don't always have a lot of resources because they're putting them towards their health.
Right.
And so we want to make service dogs accessible as far as being affordable and as far as getting the dog goes. So for us, we actually use shelter dogs and rescue dogs that are present in the shelters that we run through a temperament assessment to make sure they have the ability to do the job, and then we help owners train them.
Okay.
And then we can also use a dog that somebody already has as long as they have the right temperament to do it.
Okay, that's great. Thank you. We do need to take a quick break, but coming up next, we'll not only meet one of these remarkable dogs, but also someone who benefits from her training and medical assistance, and learn firsthand what these dogs mean to people who need them right after this.